Someone asked me, I saw a video that you were doing a critique of waptek, and do you have any speculation on why the nurse practitioner Sarah would or could lie about this? Now, this is something I alluded to in the video, and at one point I even put in fake nurse, but I didn't say lie or exactly that. So I'm going to do a few things here. I'm going to describe the procedure I came through to evaluate her video, which is all we have because the Facebook page was taken down by idiot Facebook. And she is citing a source that is anonymous, which is also another layer I can't go through. And I can't evaluate her. I can't evaluate the source at all, so I can't, critique the source, which is an acceptable thing in some cases. I can't see if this is a person who has a tendency to do things that are false, true, or a mistake, nor even confirm whether or not the person's a nurse practitioner. So the assumption I go through, and this is an assumption, is I assume the person is a nurse practitioner and or an overqualified nurse, giving them the benefit of the doubt. And I try looking up all of the assertions because I can't look up them, their experience, evaluate anything. But again, a nurse, underqualified to overqualified, almost being a doctor in wherever you are, can be a person with a huge amount of education and a huge amount of experience and just barely not qualifying a doctor, all the way down to a person with no fucking idea what they're doing. The majority of them I run into are extremely overqualified nurses, bordering on doctors, and in a hospital setting, not necessarily a traveling nurse, but usually a hospital setting, they're very overqualified. Now, in the video, I overtly said I was questioning whether or not the person was reading from a source. This is the way I evaluated it. Because a bunch of assertions were made about the video that had nothing to do with the content, but some of the sites told me what the video said by giving a transcript, or gave an assertion about what was said in the transcript that was accurate. The only thing I could get rid of was the politically motivated bullshit assertions about it. So I had to evaluate the transcript, thank you very much all of you people out there, even if you're jerks, and their conclusion about what was said, which was partially accurate. So I used some of them. Next layer. Was able to listen to the video, but I didn't want to watch the video because if I don't know what the person's background or whatever is, I usually just listen to it. If it's a long video, I don't want to sit there and stare at it. I'm looking at the transcript, I'm making sure the transcript matches. I'm editing the transcript. All I'm worrying about is getting the transcript cleaned up, not evaluating it. Then I evaluate the transcript by dismantling it in another page over here with the assertions. What are the assertions? Not the backing up of it. And then look up the assertions first. I don't even evaluate their conclusions. I don't care what your conclusions are. I'm going to find out what the subject matter is. So let's go. Here are the conclusions of the video I didn't put in the right order, and I'm going to edit them back that way in the description anyway. Dr. Cameron Kyle Seidel's video was never removed from YouTube, or anywhere as far as I can find. He didn't want to follow the hospital's ventilator protocol because it was unsafe for the patients because he found out the standard procedure shouldn't be used on a non-standard virus. Did he step down or is he still employed there? The assertion is he was fired, silenced, erased, everything, every trope possible. But did that happen? I haven't found a positive indication one way or another. I do know he's at the end of his rope from his manner. Again, I'm evaluating someone's mannerisms, not their assertions. Has he posted recently? No, not as far as I can find. Why? Because I think he's too busy trying to kill off a fucking virus that's killing people. He really said many come in with clear-looking lung x-rays and are alert but have low oxygen levels, and it was a lot like altitude sickness, as if they were stuck on a plane 30,000 feet up, cabin pressure is being let out, and they were being starved for oxygen. But they were alert, and it was weird. It's almost like they were able to survive on less oxygen somehow. He didn't understand it. Still nobody knows. Next statement. High ventilator settings damage coronavirus patients' lungs. They found out about it. So they avoid intubating ventilators. Doctors are having success treating it with non-invasive high-flow nasal cannulas rather than ventilators and are ignoring protocol about oxygen level and putting more oxygen into them than they would use as a cutoff for going to the ventilator. Because again, if you're up, alert, mostly functional, and you're able to sleep, but you're taking in, let's say, more than 6 liters of O2, no specification was given on the timing, by the way, in the video, but you're still okay. The reason they take you off of the airflow or mask and put you on a ventilator is You're not able to survive. These people are surviving on low oxygen levels, like a person who's been a Sherpa up in the frickin' Himalayas. That's adaptation. Let's take advantage of it. So Dr. Cameron Kyle Seidel is an idiot or a smart person dealing with a new situation by not using old rules that don't work anymore. He's like a lot of them. He's been corroborated by others. Yeah, he's right. Stating something factual, good. Drawing dumb conclusions, bad. Let's go on. Medicare doesn't make a standard one-size-fits-all payment scale that says, oh, if you put them on a ventilator, you get triple your money. Or if they're a COVID-19 patient, we give you more money. That's not how it works. Now, what's ventilation? In most cases, not all, ventilation means that you intubate them. Now, some of you might already know what that is, but I'm going to spell this out. You know that time you went in for surgery and had to be put under, and they put a tube down your throat, and you were under anesthesia for a long time, but they had to put a tube down your throat? Some of you experienced that. Was it for 3 or 4 days? No. Would it be a good idea to be on medical grade, surgery grade, internal medicine grade anesthesia for more than a few hours? Is it? No, because it has a high death rate. But if you're already going to die, and this is the only way to keep you on O2, is to keep you from fighting the ventilator, which is forcing your lungs to inflate and deflate. They have to paralyze you like that. They have to shut you down so you can't fight it. So now you might know why it's really horrifyingly expensive and dangerous. This is normally done for people who can't breathe on their own. But again, he's seeing patients that technically qualified as not being able to breathe on their own because the O2 level's too low. But they're still breathing. Standard procedure shouldn't be used for non-standard viruses. But now you know why it might cost more. It might cost more so they pay more. Not that they're getting a bang for your buck. Hey, let's get a money jackpot. If you keep bringing up this disease is a moneymaker for the frogs gay and Al Gore global warming shill, Fuckerberg you. Vitamin supplements don't cure viruses. If you're infected with a virus and it's gotten to this stage, that won't do any good because it's already infecting the cells. The cells have already been hijacked. The immune system can only fight the virus outside of the cells. And if your body is already producing this much of an effect, your immune system does not have that capacity. The lie of vitamin supplements being able to prevent disease isn't really a lie. It just means that if you are grossly malnourished, if you don't have any nutrients, you're much more vulnerable. Megadoses don't really prevent it. No, this is clinically proven. It doesn't work. Yes, I'm talking about everything. No, marijuana doesn't cure cancer. Just shut up. Shut the fuck up. Yes, left-winger assholes, shut your fucking vegan Nazi ass mouth. Shitty mouth? No, I meant ass mouth. Hey now, you're an ass mouth? Anyway, let's get on with it. No, it doesn't cure shit. It can prevent it. There is no doubt that being malnourished will get you deader than shit. But mega doses of vitamin C do not cure viruses and they don't prevent them. If you have the minimum amount needed, you're good. That's one daily vitamin pill a week. You don't have to take it every day, by the way. They're micronutrients. That's why they're called micro. But we're doing nano, blah, blah. Shut up. Next. Talking about the combination of hydroxychloroquine and or azithromycin in patients shows no evidence of antiviral clearance or clinical benefit of any kind. There is a study out of 5 that said the opposite. That's nice. That person lied. It's been thrown out. They fucking shilled it. And have an investment in selling hydroxychloroquine and stuff like that. A lot of them do now. Follow the money. Bunny. As defined by the legal jurisdiction, nurse practitioners are required to either have a lot of experience and a lot of education and a lot of training, or they can work under the supervision of a doctor after an online course and very few hours of patient contact. I can qualify as an idiot nurse or a fantastic nurse. Fantastic nurse takes years. There's nurses, and then they're called nurses, but they're really fucking doctors. There's a lot of variation. So if I can't evaluate the person's actual qualifications, I can't evaluate them. So what do? I don't judge it by the source or the person they're citing as the source because I can't evaluate them. So I have to just take the claims. Those were all the claims in the video that were important. No, those are the claims that are accurate. Let's talk about the claims that were made. A friend of mine who's a whistleblower in New York City treating coronavirus patients said they're killing the patients, putting them on a ventilator. They're putting people on nasal cannula, but, polar opposite statement, due to fears about the virus spreading, they're not being placed on nasal cannula, CPAP, or BiPAP. But those work. Why wouldn't they do it? It's cheaper. They're putting them on ventilators to make money or to kill them on purpose. Frog's gay murder. Using zinc, vitamin C, vitamin A and D, and hydroxychloroquine and Zithromax is being avoided. Because they don't work. Because they have no clinical benefit. Because by the time that video was posted, it was contraindicated to every hospital because it was showing a high risk of death caused by it. Treatment or cure is worse than the disease. Why did the person use the word Zithromax when the antibiotic is called azithromycin and it only kills off bacteria and has no effect on viruses? Zithromycin, or Zithromax, is used to make sure that while you have a lung infection from a virus, you don't get a bacterial infection because you will. This removes one more damn thing to have to fight for your body and improves your lifespan. But the anti-malaria drug doesn't do any damn good with it or without it. And what actually works is azithromycin, not Zithromax. Why did this person bring up that particular name? Why not call it azithromycin? That's what you're required to say, not the brand name. I mean, not required. But okay, in the state of Oregon, you're required to use the generic name. You're supposed to use the compound's name, not a brand name. You know, butt tuxer. What is it? I don't know, but I put it on the paperwork. That doesn't sound like a registered nurse, a nurse practitioner, or anybody who's been in a hospital long enough to learn you don't use the brand name. Other states may be different, but I've never seen this before. That was something I judged the person on, but let's go on. Quoting a Minnesota Republican senator squawking on Fox News with Laura Ingraham is not a citation. Or saying Medicare pays more money if you just say it's coronavirus or if they're put on a ventilator. That's political rhetorical shit. Why is that in the video? Saying Cameron Seidel was removed for speaking out and his YouTube video was pulled isn't corroborated or is simply not true or is a lie. Did they take him out of the ICU because he said, I'm not going to follow this procedure that kills people? Probably. Maybe. Did they remove him because he spilled the beans? No. Is he at the end of his rope for having found out that maybe they're doing something that's increasing the death rate? Probably. It's very visible in his videos that were never deleted. Has he refused to post recently? Probably. Because he's busy trying to fight a fucking disease. He's become embedded in this. Restating my evaluation of the video. Again, I made a mistake because I didn't watch the video because that was unnecessary. I was trying to get I listened to it while I was making sure the frickin' transcript was accurate and then evaluated what was said. She was either reading from an email off to the side, which would corroborate her partially, or she was reading from a script, which would say she's a shill or made it up, or she was reading notes in a combination of an email onto the side. I can't tell. She looked left and right. Does that mean she's shifty? I didn't want to evaluate it that way. But I made a mistake not noting that. I said I don't know, because I didn't. Do I think she's lying? Saying something that isn't true is different than lying. She might have been repeating something that isn't true. Her anonymous source could have been doing the same thing. Her not correcting her anonymous source on being wrong here is bad. Her not knowing better means that she's probably not an overqualified nurse. If both of them believe what is being said completely and totally in the video, including the words of murder, then I would claim that this is a shit source for information that should be ignored. Now, I've done a redo. This is me redoing the whole freaking evaluation. So, do I want to speculate on why we could claim that she's lying? I don't want to claim that. Thanks for watching. Have a good day. Good luck with that. I think she's wrong or ignorant, not a liar.